Remedies for neck pain. Introduction. Neck pain is an extremely common musculoskeletal disorder among the population. Cervical pain, which is concentrated at the level of the cervical spine, affects all structures of the neck, muscles, nerves and vertebrae of the spine. Chronic neck pain essentially depends on the assumption of incorrect postures, cold strokes or stress. The acute variant, on the other hand, is related to more serious cervical trauma, such as whiplash, cervical hernia, dorsal hyperkyphosis, lumbar hyperlordosis, osteophytes, bone spurs, spondylosis and power sports with overloads. What to do? Wear a soft cervical collar to protect the cervical spine. This remedy is indicated for neck pain due to whiplash or cervical muscle tears. During the night's rest, it is advisable to rest the head on an orthopedic pillow specific for cervical pain. Always assume and maintain correct posture. This remedy can relieve or prevent neck pain. Perfectly adjust the position of the computer screen. By doing so, you avoid turning your head or constantly shifting your gaze up or down the monitor. To reduce trauma-dependent cervical pain, cold compresses are recommended at the cervical level. Cryotherapy is particularly suitable for creating a sort of analgesia on the site affected by pain. After 2-3 days from the trauma, replace the cold packs with hot showers and hot water packs on the neck. Undergo targeted physiotherapy massages to relieve neck pain. Perform specific exercises regularly to relieve. It is recommended to practice gymnastics steadily and slowly, avoiding fast movements and sudden jerks that could exacerbate the problem. Seek immediate medical attention in case of neck pain associated with continuous tingling of the arms, inability to touch the chest with the chin, loss of strength in the lower limbs and hands, or persistent and relentless pain. After having achieved a moderate improvement in pain with conservative therapy, massages, orthopedic collar and pain relievers, it is recommended to undertake a specific rehabilitation process, aimed at maximizing the general health of the back. After surgery to remedy cervical pain resulting from a cervical hernia, observe a recovery period of 30-40 days. After any surgery to relieve trauma-dependent cervical pain, it is recommended to undergo regular routine checks to ensure that the surgery has been successful. In the case of idiopathic high fever associated with neck pain, it is strongly recommended to seek medical advice. These symptoms may hide an active meningococcal infection. What not to do? Staying in one position for too long. Sleep on your stomach, with your head tilted to one side. Such a posture during rest can cause or accentuate neck pain. Apply ice directly to the skin of the neck. This attitude could create cold burns. Instead, it is preferable to apply an ice pack wrapped on a cotton cloth to the cervical area. Perform the exercises for neck pain quickly and with sudden movements. Such behavior can even aggravate neck pain. To delay. When cervical pain suggests a cervical disc herniation, it is recommended to seek immediate medical attention to start any conservative, surgical treatment as soon as possible. Assuming malicious positions. Excessive rest, even too long rest does not help cervical pain. An excess of rest in fact favors the rigidity of the joints and muscles, already weakened by themselves. Rather, it is best to take a restful position for 30 minutes, after which a walk or light physiotherapy exercise is recommended, specific for neck pain. Lifting heavy loads in the presence of neck pain. Drive immediately after surgery for the healing of cervical pain dependent on a cervical herniation. Engaging in power sports, such as weightlifting, which may aggravate neck pain. What to eat and what not to eat. There is no scientific evidence that food relates to improvement or worsening of neck pain. It is recommended to follow a healthy, balanced diet, rich in fruits, vegetables and low in fat. After any corrective surgery, for example discectomy for the treatment of cervical hernia, it is recommended to follow the light and balanced diet suggested by the nutritionist or a competent and qualified health professional. Cures and natural remedies. In the most cases, neck pain requires drug treatment. Otherwise, the natural remedies used as first-choice therapy are not very effective, because cervical pain is generally annoying and intense. However, considering that stress and tension can accentuate neck pain, the affected patient can take relaxing and anxiolytic herbal teas, formulated with active ingredients such as chamomile, chamomile cutida, mild anxiolytic and sedative properties. Valeriana officinalis, hypnotic, anticonvulsive, sedative properties of the central nervous system. Lemon balm, Melissa officinalis, antispasmodic, sedative properties. Escala, Estscholza californica, sedative, hypno-inducing, analgesic, relaxing, and neuralgic and spasmolytic. Linden, Tilia cordata, relaxing, anxiolytic properties. Zinc, a remedy for stress, to be taken in tablet form. In addition to relaxing herbal teas, it is possible to apply creams or ointments formulated with rubefacient active ingredients to the skin of the neck. Capsicum fruit essence, rubefacient, antibacterial, analgesic properties. Camphor, Cinnamomum camphora, rubefacient properties. Arnica, Arnica montana L, anti-inflammatory, antirheumatic, revulsive, analgesic properties. Arnica ointment. Delac Arnica gel cream is a 35% concentrated product and is made in Italy. This gel cream is made from organic mountain arnica which has been extracted using a particular technique, that of ultrasound. In this way, high-quality phytoextracts are obtained which have not lost any of their original active ingredients. Eucalyptus and mint are the two essential oils added to the gel cream formulation to enhance its action. Prevention. Do not lift heavy loads in the presence of cervical pain. Such behavior increases the risk of hernia, both cervical and abdominal, example inguinal hernia. Stretch and strengthen the cervical muscles involved in previous trauma. This remedy is particularly suitable for preventing possible future cervical damage. Respect rest in case of severe cervical pain, in order to prevent jerks or sudden movements that could favor the onset or aggravation of the cervical hernia. Before starting any targeted training program, example weightlifting, it is recommended to consult a doctor or a qualified instructor, in order to prevent any muscle tears or injuries, responsible for neck pain. Medical treatments. Discectomy surgery, anterior or posterior, consists of the removal of the herniated disc and subsequent replacement with a small bone fragment, usually extracted from the pelvis of the patient himself, which leads to the fusion of the two vertebral bodies to which it is interposed. An artificial disc prosthesis that replaces the diseased disc while preserving as much as possible the movement and function of the rachis. Oxygen ozone therapy consists of the introduction of an oxygen-ozone mixture in the intradiscal area. Ozone, exerting a moderate anti-inflammatory power, reduces disc pressure and relieves pain. Osteopathy, relieves any nerve compromises at the cervical level. Electrical stimulation, spinal nerve stimulation, useful for awakening the spinal cord, reducing pain. Ultrasound therapy, mechanical that uses the mechanical energy of very high-frequency sound waves to relieve cervical pain. Ionophoresis, allows administering a drug transcutaneously using direct current produced by a generator. Massage therapy, rehabilitation medicine which consists of the execution, by an expert figure, of specific massages to relieve pain, cervical, in this case. Acupuncture, relieves inflammation and neck pain. Please share and subscribe our channel. See you in the next video.